right now there's a lot of people who, of course, if they end up in hospital, you can't be visited by friends and family. So nurses are filling that role, not just of being the people who are the liaison, obviously, in part between the doctor and your care, but they are really human contact. It's something that they always do, but in a time when so many people can't see family because of the rules about who can visit, the role of a nurse, more special than ever. Our nurses are always angels amongst us. They are the definition of what humanity is really looking to be. A hand to hold, a sense of salvation amongst the worst possible suffering, and a reassuring presence. But since the pandemic hit, our Aussie nurses have been doing this in overdrive. They've been on the front line for almost 2 years now. And when COVID-19 hit our shores in March last year, they whacked on the PPE and jumped smack bang into the line of fire. And the strain on them is no laughing matter.
I think it's really important to understand that the frontline health workers have been working incredibly hard for a long time. We're seeing now that there's a high level of fatigue and chronic fatigue, given that this situation's been going for effectively 18 months.
But there's something profoundly unique about what our nurses are currently doing. From the COVID-19 ICU ward to the emergency room to the Paediatrics department for our little ones, nurses have been cast in a role in this lockdown that's a bit different to the norm. You see, with some exceptions, visitors are not allowed to see their hospitalised family and friends.
Unfortunately, at the moment, due to the current restrictions with COVID-19, most hospitals across New South Wales are rolling out a strict no visitor policy. Unfortunately, what this means is absolutely no one other than the patient is allowed to enter the facility. That starts from the moment you walk through the front doors of our hospitals.
We are, as a blanket rule, we're not allowing visitors into the hospital at the moment.
And this kind of isolation for a patient, cut off and in a foreign environment, well, it's pretty scary for some people, big and small. So who's been bridging this daunting COVID divide? You guessed it, nurses. They're filling the void of human contact with our loved ones, and they're doing it pretty damn well.
Obviously, not only are we providing nursing care, we always do, we always will, but we need to help them feel safe as well as cared for. So this means we're doing a lot more communication at the bedside. I've never answered so many phone calls from loved ones ever. We're doing a lot of extra peddling when it comes to trying to make sure that they can use the telephone to talk to their loved ones. We have extra charging banks for patients' phones. Basically, there's just a lot of extra communication, empathy, and trying to reassure everyone that everything will be okay.
There are some fantastic nurses out there, these young, eager, superhero of human beings who, will be at the ready to comfort you, say the right thing, make you laugh, or even hold your hand when you're at your most vulnerable.
They're the only people that patients see at the moment. So they're doing all they can to offer a shoulder to lean on to calm the loneliness.
It's been basically left to the nurses and midwives to be the communication connection between their patients and the relatives and the people who would normally visit and provide support and assistance to their patients.
So next time you see a nurse, or any frontline health worker for that matter, give them a smile or a wave, or if you can, say thank you for doing what they do and being who they are, and especially what they've become to patients who are cut off from the outside love that everyone needs.
This is very important extra burden that they're carrying, which would normally be balanced out with visitors. So no doubt everyone is working really hard in the most challenging circumstance.
Most definitely. Thank you to all of our nurses. And I've got some very good news for two incredibly big-hearted people that you saw in that conversation. To Kate and Stephen, who we featured in that story. The good people of Harvey Norman, from Katie and Gerry and the entire team at Harvey Norman, they're going to give each of those nurses a $2,000 gift voucher to buy whatever the heck they want in any of the stores. Can do it online, do it in person. But thank you from Harvey Norman to the nurses who are delivering oh so much for people who really, really need it right now. And thank you to everyone who is a nurse right now.